Hey, so Saeed, thanks so much for taking a couple minutes to just answer a few questions and kind of get the scope of what's really going on. We are in an unprecedented time, as you can imagine, and as we all try to think about, you know, what can we do in response to this pandemic? Obviously, in Canada, we're a little bit ahead as far as the spread rate. We're at about 10,000 cases in Canada as of today. Beginning of March, maybe March 10th, we were at maybe 60 or 70, like it was under 100. And so we've seen it mushroom, explode in the last 3 weeks. We can only imagine that a healthcare system like Canada's that's scrambling to to start keeping up with this wave is going to be maxed out. But man, Ethiopia just does not have the healthcare system and the infrastructure set up to handle a pandemic like this. First of all, Saeed, can you just give people a little bit of a scope of who you are, what your role is in with Imagine One Day, and what you guys do, and then we'll dive into what can Run for Water and Imagine One Day do together. So, who are you, man? And tell me a little about your relationship with Run for Water.
Thank you, Peck, for giving me the opportunity to talk about COVID-19 and its impacts in Ethiopia. My name is Seid Aman. I'm the country director for Imagine One Day, based in Ethiopia. Imagine One Day is a Canadian charity that has been operating in Ethiopia since 2008. We are education-focused charity that has been providing access to pre-primary, primary, and secondary education in the rural communities of Ethiopia. And beyond that, in our partnership with Run for Water, we are also bringing clean water to communities. That is aiming to enhance hygiene and sanitation coverage for the rural communities that won't have access to safe water and sanitation infrastructures.
Well, thank you so much. And I mean, over the last 10 years that we've been working with you guys, I can't say enough about your team, Saeed. You guys have been unbelievable. You guys are on the ground, engaging communities, getting people active in changing their own lives. And I think that's what's so unique about your team. You guys are there to empower and change the mindset of people to be able to help themselves. And I think that's what has really struck me and our partnership over the last 10 years is your team's dedication to empowering the local people to change their own thinking, to change their own community. So that's been really exciting. Saeed, tell us a little bit about just set the stage for us. What do you think's going to happen here as you guys try to do whatever you can to stop the spread of the disease in Ethiopia, because this could be absolutely devastating for your country. So what do you think is the best approach here, and using the tools and resources you have? What's your approach to help stopping this?
I think as a country, it was on March 13th that the government of Ethiopia declared the first case of coronavirus in the country. And since then, the number of cases has been increasing. And as of today, we had about 29 cases reported and confirmed. And the government of Ethiopia has recognized that the world is facing a global health crisis, and started to implement strong containment measures that limited travels. That also includes forced quarantine, as well as also identifying people with symptoms and putting them in isolation for 14 days. And different regions have also banned gatherings and travels between urban and rural communities and or between urban communities. So different strong measures have been taken to contain the virus and to stop further spread of this COVID-19. But yet, as as developing country, we have pre-existing, poverty and inequality, and a lot of our people live, in with less than $3 a day, which means, most of our people, particularly in the rural area, they don't have, let's say, access to clean water. They don't have access to, proper sanitation infrastructure. What that means when it comes to this pandemic is that they are vulnerable and exposed to this virus, because one way to protect COVID-19 is by washing your hands frequently. If you don't have water, let alone to wash your hands, to drink, then it means you are highly exposed. So because of that, and because of the kind of health infrastructures we have in the country, we have the concern that our health infrastructures that exist are going to be really stretched with more cases to come, and we may not be able to really provide high quality health services for everyone. So I think as a country, as developing country, the best way to go for Ethiopia is to protect the spread of this endemic, and one way to do that is to provide safe water for communities that do not have access to safe water and proper sanitation infrastructure.
Yeah, if I think, Seid, if I think about all the communities that we've been working with you in over the last number of years, I mean, we've provided water to them, and we're talking about, hundreds, 100,000 people or so. If you think about the, how long we've been working together, these communities, they have water, but they're still very vulnerable. So what I think, can you outline some of the possible things that your organization wants to provide your teams and these communities that are vulnerable? What do they need? Do they need masks? Do they need, do they need soap? What do they need? Training? What can we do as a Run for Water community to help empower your team and the health workers that you guys engage with to help stop the spread into these vulnerable communities?
I think what I would ask the global community, in terms of supporting Ethiopia and our people is we really need to put a lot of efforts as early as possible in terms of preventing and containing COVID-19. And the first thing to do is we really need to equip our people with information about COVID-19 and how they can protect themselves from COVID-19, because most of our people who live in the rural area, they don't have access to television, they don't have they don't have enough access to internet, and so what is needed is we need social workers who goes to the community and demonstrates and create awareness about this pandemic. So I think we need to invest on creating access to information about the COVID-19, and also provide them with basic supplies like soap, hand sanitizers, which are very basic to really protect from this pandemic virus.
That's I think that we are Run for Water is very prepared to come alongside you guys. One thing I really want to make clear is that I listen to our prime minister a couple of days ago talking with the G20 countries, and I've heard this reiterated on a number of fronts, is that this is not a national issue. This is not a Canada issue. This is not a U.S. issue. This is a global pandemic. And if we do not, if we think we can just put our head in the sand and just take care of our own country, we're deceiving ourselves, because this will bounce back. We need to, as a global community, we need to work together to help blot it out all over our country, all over the world, and stop the spread of this thing, so that we can buy ourselves time, so we can get a vaccine developed in about a year. But if we let this thing mushroom in Africa and other places unchecked, it will bounce back into our country. And that is it, and so I think now is the time not to turn inward, but now is the time to think on a global scene. And I think, we are very prepared, and our people, Run for Water people, have reached out to me and said, what can we do to stand with our brothers and sisters in Ethiopia to help stop the spread there as well? So I want to, let you know, Seid, that please communicate to your team how much we are standing with them, and we are going to be able to provide supplies and funding for you as you guys are on the front lines helping this in these very marginalized rural communities especially. So I want to let you guys know that.
Yeah, thank you, Peg. We really appreciate what Run for Water is doing. As soon as you guys heard about the outbreak in Ethiopia, and what the global community need to know is that this COVID-19 could be more deadly in Africa than elsewhere in the world. It hasn't been so far because it just started. It has been only in Ethiopia the last 20 days. The number is increasing, and it is getting out of the capital, and we are now hearing cases from the regions, and that means the spread is continuing. And with the health system in Africa, which have limited capacity, I don't think that we can absorb the pandemic, and that is going to really stretch our health infrastructure and our health personnel's capacity. So I think the strategic approach should be focusing on containment and aggressive preventive measures that the government of Ethiopia is also promoting. But that do require resource of including like providing safe water and providing sanitation supplies like soaps and hand sanitizers, as I mentioned earlier, and also creating access to information for every community that we are serving, so that we can at least mitigate the level of the risk that our people could face.
Totally. And Seid, I think those kind of three things is a great starting place for us. And to that end, as you know, Run for Water has already released funds to a media organization in Addis. They have already created campaign videos explaining how to wash hands, how to do physical distancing, how to greet someone culturally in Ethiopia without touching. I know that's a connection and physical contact is part of the way of life in Ethiopia. And so to get through that, to change kind of some of those behaviors and practices is going to be a challenge. But we've already funded educational material. We are going to be releasing funds to you guys this week to help buy sanitizer, to help buy soap, to help buy some masks that you can start distributing out to health workers and your team out in these remote places to get them prepared. So we are going to stand with you, and we're already moving ahead in these kinds of ways. And Run for Water supporters, 100% of every dollar that you donate will go directly to Seid and his team to help them on their frontline abilities to help stop the spread of this. I cannot give this as much attention as possible. Our time to act is now. 3 weeks from now, this is going to be too big for us to do much. Now is the time for us to invest and to say, can we help stop this and get people prepared? One of the challenges you were telling me about the other day, Seid, is just the lack of education. People don't understand how diseases are spread in some of these remote communities. Can you talk a little bit about some of the religious challenges or some of the cultural challenges that you guys face in helping communicate some of these, some of these measures to remote people that may have no understanding of how communicable diseases are transferred?
Yeah, thank you. I think that there are already a lot of resources out there, about how to protect ourselves from COVID-19. Out there in on social medias and available in many platforms that are issued by World Health Organization and other international organizations. But these resources are not easily accessible to our poor communities in rural Ethiopia. Even if they are not, even if they are accessible, most of our people in these rural communities are illiterate. They cannot read and write. That means we need to design a specific way to reach them, to sensitize them about COVID-19. So the one size doesn't fit all. What worked for developed countries may not work for Ethiopia because our context is so different. That's why we need to have people going to the communities, practically showing them how to protect themselves from this pandemic. You need to show them how to wash their hands. There is already pre-existing poor hygiene practices, poor water coverage and sanitation services. All these are putting these people, at risk, and will expose our people to the spread of this contamination by the coronavirus. Mm-hmm. So, the level of education that our people have is one risk factor. In terms of protecting themselves. They cannot access a lot of the information that is already available out there. We need to design the right way to reach them. So we need to focus on community outreach activities, and that's what we are doing here at Imagine One Day.
Yeah, no, I really appreciate that, and I think it's a great example of why indigenous organizations like yourselves, Ethiopians on the ground helping Ethiopians, is absolutely essential here. You understand the context. You have local people in all these communities that understand and know the language and know how to communicate with these people. Just for a context for our Canadian listeners here, in Canada we have roughly one physician per almost 200 to 300 people. That's an incredible, one of the highest coverages in the world, right? I mean, we have physicians for one for every 300. In Ethiopia, I was reading last night that the average, just as far as even including Addis, it's one to every 15,000 people, and I would say it skyrockets even worse than that in a communities out in these rural places. How many of the communities that we work in even have a health clinic? Probably zero. I mean, you are working with the most marginalized population on the planet, Seid. These people don't have health clinics even. So, it's not like what would they do? There would be nothing they can do if this virus spreads through a village like Gorobantu, or the number of these these communities that we've run for, like Run for Water. I'm wearing this shirt, right? And it's like these are the people that we have brought water to, but they need supplies, they need education, they need your people on the ground to say, here's how to protect yourself. So we want to stand with you and give you the supplies and what you need in order to educate and empower these people to protect themselves. Is there anything else that you want us to know, Seid, as in this? I'd like to do more of these as the weeks go on. Keep our people engaged. anything else you want our audience to know about what's happening in Ethiopia and what they can do to respond?
I think Peggy, you touched on a very good point. If COVID-19 is having this much impact on the most wealthy countries in the world, like U.S., Spain, Italy, and Canada, it is not hard to imagine the impact of this pandemic in Ethiopia unless we act immediately and start to contain the virus before it is spread widely. And once it went out, to spread to many people, it will be difficult for Ethiopia to really overcome it because our health infrastructure. I was reading one article a day before that the number of ventilators that we have are very, very few. But we heard that even in the U.S., like the New York City, has been facing that challenge.
Right.
But in our case, given the size of our population, and given the accessibility of the health clinics or hospitals that could help patients, it would be difficult to really imagine treatments. That's why I'm saying that as Ethiopia, we really need unique response to COVID-19, which is really mainly focused on protection. And that should happen now before it gets late.
Yeah. No, I couldn't agree more. I just, I'll be honest with you, man. I'm nervous because we have worked so hard over the last 13 years to empower people with access to clean water. And if it's just for this moment, you know what I mean? Like these, at least the communities that we've been working in for 13 years, they have a chance. They have a chance to defend themselves against this infiltration of this virus. They have a chance if they get the right information, if they get access to some soap, if they get access to some education. These rural villages could wall themselves off and stay vigilant and then protect themselves. But I honestly do, Seid. I'm not trying to make this bigger, but I fear what could happen if this spreads in a country like Ethiopia. It could be absolutely devastating in the millions of people that could be lost by this. And so my heart goes out to you, and I want to say to you, we are standing with you. We love you guys, and we will do whatever it takes for us to take the limited resources that we have, and we will channel them to you as quick as possible the next few days so you can do your best to, you can't stop the virus, obviously. You can't, stop it in your country. But what we can do is prevent it in the small regions where we are working and protect these vulnerable people that everyone else on the planet has forgotten about. But we are not going to forget about these people that we've invested in for years. And we thank you so much and your team for the risk and for your love for your own people.
Thank you so much.
Yeah.
Thank you,
Okay, we'll be praying for you and be supporting you, and let's check back regularly on how this thing is going. We are in this together as global citizens, my friend.
Sure, we are together in it, and I'm sure we'll be over it soon.
Yeah, I hope so, my friend. So let's stay in touch, and thank you. Give my love to all the team, and a big shout out to all the Imagine One Day staff. I'll be posting this on Facebook in about half an hour, and please share it widely, Seid, and I'm going to do the same. And big thank you for all that you do. I love you guys.
Thank you. We love you too.
Okay,
Bye-bye.
ciao. Bye.